This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk on this Monday. Thanks for joining us. I'm Kyle Wiggs. We're joined by Dr. Mark Johnson from the Mon Health Surgical Care. And Dr. Johnson, good morning. Thanks for coming on again.
Good morning, Kyle. Thank you so much.
You've had a interesting trip that we're going to talk about here. You've been to Haiti, and this wasn't the first time, right?
That's correct. This is my second time to Pignon, Haiti.
Okay. So what was the group that got you involved in this? And let's start there from the organization standpoint and planning the trip. How did it all come together?
Very good. So I'm sure that some of the listeners are familiar with the name David Fogarty. Dr. Fogarty is a plastic surgeon that's been practicing in Morgantown for quite a while now. And one of his missions and passions in life is caring for people in places where they can't expect to get that kind of care. So he developed this company called Interplast West Virginia, and he has traveled across the world and gone on over 100 trips providing free surgical care for people in need. About a year and a half ago, I had the opportunity to travel with him to go to Pignon, Haiti on one of his missions. And we did, I went with a group of plastic surgeons, so I got to help. I don't do plastic surgery, but I got to help them. And there were general surgery cases that came up that needed to be dealt with while I was there. And I had such a positive experience that I developed some, relationships with the team in Pignon. And so we had this opportunity to go back this spring and go back and do general surgery this time.
Okay. So, yes, we've had Dr. Fogarty in this very studio through the years talking about his trips and about his vision for world health. Okay, so what types of surgeries were you able to help these people with?
So we did a variety of cases. We did some laparoscopic cases. We took out gallbladders. We did a fair number of hernia repairs. We did thyroid cases. What's interesting is, one of the problems, of course, in Haiti is the lack of access to health care. And so the problems that they develop are problems that, here in the States, we would identify and deal with a long time before they finally get medical attention in Haiti. And so, we did 6 thyroid operations, and of them, 5 of them were the biggest thyroid goiters that I've ever seen in my career. And so it's just it's an amazing, to see the need, and it really is a different level of disease down there compared to what we're used to seeing here in the States.
Yeah, it really puts into perspective the blessings that we have with our healthcare system. It certainly isn't perfect, but in terms of taking care of our own, we do a fairly good job in this country, don't we?
Yeah, no question.
Okay, so what about the age group? Was it children through adults, or how did that break down?
Yeah, yes. There was a wide spectrum. A few children. Most of the patients were in the 50 to 70 age range. Yeah.
Okay. What type of facilities did you have?
Well, there's a hospital there. It's called Hôpital Bienfaisance de Pignon is the name of the hospital. I'm working on my Creole, by the way, Kyle. I'm not very good at it yet, but I'm doing my best. It's a hospital, and they provide care. They provide acute care. So there was a gentleman that fell into a ditch and broke some ribs and broke his pelvis, and he showed up to be cared for. We took care of him and did some work on him. But they also do, they have the capacity to do surgery, and the OR is very reasonably equipped. Not the things that we use here at Mon Health, but very close to it, and certainly capable to do what we needed to do there. It's funny though, we were there for a week. We did 44 procedures in that week, and we really kind of overwhelmed that hospital. By the time we were done, there were people, patients in the hallway and patients jammed in the rooms because they just didn't have any room for anybody else. So we kept them busy that week, that's for sure.
Well, that's my next question. How did the word get out? Were some of these scheduled in advance, or was it word of mouth once you were there on the ground? How did that all work out?
A little bit of both. They have there's the hospital is run and built by a now retired general surgeon, just like me. He's a member of the American College of Surgeons, and so we bonded over that experience. But now the hospital is run by a younger gentleman, Dr. Eric Toussaint, and Dr. Toussaint is a general surgeon just like I am, and so he runs a clinic and sees patients. When we were going down there, they advertised that we would be there, and so that generated a lot of interest and a lot of people that, for one reason or another, didn't come looking for help beforehand. When they found out we were going to be there, they showed up.
So, how many people did you travel with? How many people were in your party?
Yeah, it was a total of 7 of us. Most of them are Mon Health associated or employees. Beth Stepik is a circulating nurse. Latrice Holloway is a recovery room nurse. Dr. Matt Coleman is an anesthesiologist. Kaylee Welch is a nurse anesthetist. And then we traveled also with 2 interplast veterans, Lucy Pierce and Libby Hupp, and they're both nurses as well. So there were 7 of us that went down there on this trip.
Okay, so you had the pre-surgery covered, post-surgery covered in terms of your team. You had 2 anesthetists. You had a couple of hands there to help. Did you work with the people there, or did your team handle it?
Well, a little bit of both. They do have a functional and working operating room, so I worked with Dr. Toussaint and with Dr. Paul. They're both surgeons that work in that facility. They have some very accomplished and skilled surgical technicians. So, in terms of everything from managing instruments, preparing for the cases, and then they proved to be very helpful assistants. So some of the operations that we would do, that they would help me to do them. They do have, they have, it's a hospital, so they have some facility for recovery and some facility for, caring for patients. It's a big difference between the kind of care that you could get there versus the kind of care you can get here in Morgantown. But it's they're comparable. It's the same thing. So we took advantage of those resources, and like I said, we kept that whole hospital busy. Everybody from the admitting people to nursing personnel and to the OR personnel.
Wow, outstanding. So what about the language? Was there a language barrier at all, or in terms of mixing terminology, was that an issue?
It's a little bit of both. I mean, certainly you can appreciate, for me, interacting with my patients is the reason I get up every morning. And so to have a conversation and to talk to somebody about what they're going through and, how their cousin is doing or how their grandchildren are doing, that's what drives me. And so you miss out on some of that, and you miss out on the ability to connect with some of those patients. In the operating room, there are some similarities. Some of the instruments, for example, are similar enough that they could understand what I was asking for. But after a while, you just kind of figure you find a way to make it work. So like I said, I'm learning Creole now, and hopefully I can do a better job when we go back. But it's definitely a bit of a challenge.
In terms of supplies and instruments, you used everything that was there, right? Were you able to take anything with you?
Yeah, I mean, again, this was one of the things where Mon Health was really, really supportive of what we're doing, not only just in letting me steal their employees and take them with me, but also in terms of supplying support and I took several of the instruments that I use here at Mon with me. We took some disposable supplies, some sutures and things of that nature, some of which, interestingly, suture material expires. And so here in the States, once it goes beyond its expiration date, you're not supposed to use it. Well, in Haiti, it's still perfectly good and valid and sterile and everything else. And so in Haiti, because of their needs, they're more than happy to use stuff that's no longer usable here in the States. And that we took a lot of that stuff with us.
Yeah, that's outstanding. I mean, again, any little bit helps. So what was first of all, what was the date of this trip? And you had to postpone it, right, because of some issues that were going on in that country?
Correct. And that's exactly right. Well, we were originally scheduled to go in November, and then there's incredible political unrest in Haiti, but for the most part, it's really isolated to the capital, Port-au-Prince. But it was so unstable in November that the FAA temporarily stepped in and said, well, nobody can go to Haiti, at least not coming from the United States. And so that disrupted our planned trip then. Those restrictions eased as things calmed down a little bit, and so that's why we were able to go. And we went the 11th through the 18th of March.
Okay, so a little bit less than a month ago, and I would imagine it was a whirlwind. It's probably all settling in with you. We're with Mark Johnson, Dr. Mark Johnson, Mon Health Surgical Care, a recent trip to Haiti, and we'll take a quick break here, come back, continue the conversation. And a couple of times you heard Dr. Johnson talk about learning the language and going back. So we'll talk about that when we return. Stay with us. Mon Health Talk will continue after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday, we're visiting with Dr. Mark Johnson, recently back from Haiti, where he went to provide his general surgical services. And Dr. Johnson, give us a story or two, if you can, about a patient that you met or a person that kind of stuck with you, that you really got something out of helping them.
Yeah, I think the story that we all came back with that most impressed us. There was a gentleman. He was 67, and he had a tumor or a cancer of his leg. It was by the time we met him, it was about 15 or 16 inches long and 12 inches wide. Think about 2 footballs, shoved into the tissues of your leg. And so a very impressive tumor. It was very debilitating to him. He couldn't really walk as a result of it. And the tumor was bleeding, and so he was anemic and sort of really very sick. When we met him, the story had been that somebody else had looked at that and said, well, that's too risky. We don't want to operate on that. But we sort of were in a pickle, right, because the guy was really suffering and struggling. So we agreed to do, what would absolutely be a high-risk operation to remove that growth and to control the bleeding. And I think everybody there was on edge about that case. The surgical team, the crew that I went with, I think the anesthesia particularly, I think I gave Dr. Coleman an ulcer over that operation alone. So we proceeded, and in truth, the operation went much better than expected. It was a pretty straightforward operation. We were able to remove that tumor and close the wound and leave him with a functional leg. Obviously, it took him a while to recover from the operation because he was so weak and debilitated beforehand. But an absolutely fantastic result for somebody that was really in need. And so that's the kind of thing that drives you, makes you want to go back and do it again, because it was, as scary as it really was a success story.
Were you able to visit with that gentleman or with some of the other patients that you operated on afterwards?
Oh, yeah. Well, yeah. I mean, so one of the interesting things, here in the States and here at Mon, 80% or more of my surgery is outpatient. You come to the hospital, you have your gallbladder taken out, and you go home. And you don't stay in the hospital. But for several different reasons, including access to care and the fact that we had patients that traveled some distance just to get to us, most of those patients stayed in the hospital for a day or two after surgery. And so we had an opportunity to visit with them and to see them and to, to spend a little time with them and to share in the success of what we did.
Yeah, that's great. Okay, so you're used to a certain standard practicing medicine and operating in the United States. You go to a foreign country, a poorer country, but you still manage to do this work. What's that like? What type of a mentality does that take?
I'll tell you, I mean, that's the most interesting thing about this whole experience is how far outside your comfort zone you go as soon as you get there. I mean, everything about it is not normal, right? I mean, we were in a town of 30,000 people, and there were only 7 white people in that town, right? So that's an unusual experience for most of us, or at least for me. And so the language is different. And the hospital, I mean, it certainly is a hospital and so forth, but in terms of the standards and the nursing care and even, the cleanliness and all these other things, it's a lot different. In the operating room, again, you can tell that it's an operating room, but it's equipment that you're not used to using. It's, and again, you're trying to communicate with the staff there that kind of understands you. They know a little bit more English than we knew Creole. So everything about it is unsettling. And, again, because patients don't have access to health care, the kind of cases that you see are things that we would have seen and taken care of a long time ago here in the States. And so the pathology is often worse. The tumors are bigger. The whatever is more pronounced. And so everything about it is sort of unsettling and challenging, and yet at the end of the day, it's you just do it, and that's really one of the things that I came away with that was the most impressive for me was there were 4 people down there that went with me that had never had this experience before, had no idea what they were getting into. And basically just said, "Okay, Mark, sounds like a great idea. I'd love to go to a tropical island with you." And for them to get down there and to hit, to excel like they did, and to be able to practice their medicine and do it in a way that helped all those people, that was really for me inspirational to see them step up like they did.
Inspirational enough to go back.
100%. Yep. Well, and this is the thing. I mean, if you know Dave Fogarty, you know how inspirational he is. As a person. And so, his vision is to carry on the work that Interplast has done, during his time doing it, and he wants to take that going forward. And if right or wrong, I'm all bought in. He hooked me, and so now I want to help him carry the standards and the reputations of Interplast into the next generation.
All right, we've got a little over a minute left, and I know we could do a whole show on this, but what do you want people to know about how good the healthcare system works here compared to a poorer country like Haiti?
Yeah, you have no idea what the blessings that we have and the access and the availability. You can go to Mon Health 24 hours a day, and you're going to get top-notch, excellent care. And so we take it for granted, and that kind of an experience really makes you appreciate how good we've got it.
All right, very good. So are you planning the next trip? Do you need time to decompress? How does that work in terms of getting things together to go back?
I think ideally we would go back. Yeah, I can envision maybe 1 or 2 trips a year where we're traveling to Piñon or to someplace like it. So I've already had communications with the hospital there about, when are we coming back, and they're very excited for that to happen. So we'll definitely plan to go back sometime, maybe this time next year. Whether or not we can make it sooner depends on a lot of other things.
Well, yeah, the political situation there, safety, the availability of your staff, right? And again, the making Mon Health allowing these people to go.
Yeah. No question. It was, that made a huge difference in terms of making resources available, whether it was personnel or equipment and so forth. Mon and Crystal Atkinson and Dave Goldberg were very supportive and helpful in terms of making this work. We couldn't have done it without them.
All right, very good. Well, Dr. Johnson, you've inspired people just like Dr. Fogarty before you, and we appreciate that.
Very good. Thank you.
Thank you. Dr. Mark Johnson there, again, second trip to Haiti and going back sometime perhaps in early 2026. Great edition of Mon Health Talk. We hope you enjoyed it, and join us again next week for Mon Health Talk.